We had a request to talk about point selection. So I was just going to talk about this for 10 minutes before we kind of head up out of here. So the idea of where do you start with insertion of needles as well as point selection for designing a treatment protocol. So like I just said, if you imagine your body, right? You're like this. Don't forget that you have this electromagnetic field around you, like this. Okay, so you're humming with electricity. So just like if you imagine the Earth, so if this is the Earth, you have North Pole, South Pole, and this is say positive and negative, and you have an axis going through it, and then you have an electromagnetic field around the Earth as well. And so that old saying, "As above, so below." Well, your body is the same type of electromagnetic entity. When you have an injury, say a shoulder injury, like this, you have an interference pattern in your field, in a sense. So this is causing stagnation. So imagine this is an injury. Blood is trying to flow through the area, but it gets stuck. And what happens is inflammation grows. So anytime that it's red, it's inflammation. Heat is generated as the blood is flowing through. Sometimes what you actually feel with pain is pressure buildup, because blood is flowing through the area, but because it gets stuck, there's still momentum behind the blood circulation, but again, because of the stagnation and the stasis, there's pressure buildup, and so you get the sensation of pain. So treatment strategy for pain is you have to move this. You have to move this pain, okay? And you can choose point selection to target this specific pain. So say this is shoulder pain. You can needle it directly. Another thing I wanted to say is pain always, this idea of it zigzags its way through the body, right? You've heard me say that before. So if you have pain here, like a bridge, this is going to coil your connective tissues to the center of this injury site. It's going to pull the connective tissues to that area. And when you put a needle into that, it disperses that and almost shuts off the muscle, so it doesn't, it shuts off the muscle, so the tension is released. That tension will be moved somewhere else. And so wherever you have, so imagine you have a shirt, if you have, and this is your skin or your connective tissue, if the injury site is here, it's going to be pulling up like this. Well, my shirt is connected to my hip, and so now it's pulling up this way from my hip, and now that's pulling up, now my ankle's coming off the ground, and it goes like this sort of thing in your body. It zigzags up into the neck as well. So you've seen my style of treatment of needling. You chase this pain. So you start in the shoulder. You start locally. You release this, okay? Then maybe that tension has now moved from here, maybe into the pec or the chest. So then maybe needle CD17 to center it. And then as you chase that, maybe go stomach 31, which is at the front of the hip. So you can needle here. And then maybe stomach 36. Then you can maybe needle bilateral stomach 36 to begin to stabilize. Again, you're trying to stabilize this field, right? And then you can kind of maybe come down to the ankle, maybe UB62. Then maybe come back up here, LI or SI3. You see that? So this is how you begin to piece these points together. It's not needling the body 50-50. I always like to actually consider first chapter of every book in this Chinese medicine is Yin and Yang Theory. So I actually like to imagine a yin and yang drawn over the body. So if you have this big circle around you, and a yin and yang drawn over the top of the body. You start here, you work across, you work here, then you come maybe back up here, maybe do 20. And this idea of you're trying to get this, this is when I needle.
This is so simple, and this is the first time I'm hearing it. It just makes so much sense.
So, I don't know where, it is simple, but just imagine a yin and yang symbol slapped over the top of the body.
I have this image and don't have it for the rest of my life. This is like...
Good. Okay, well, it makes sense though.
Right.
So you have to determine what's the problem, okay? Shoulder pain. And now chase this, wherever it goes. And you can certainly needle the body 50-50 and do LI4, stomach 3, so that's fine. But the real art of this medicine is to adjust the energetics in the field around your body. And so you can use needles, you can use massage, you can use liniment, a warming liniment. You can use things like castor oil or like a mud poultice, like to put a mud thing here.
Clay.
Yeah, clay. Yeah, all of that. And so this is, so when we talk about treatment strategies, this is kind of how, imagine a yin and yang.
So much, like nobody ever showed us or told us, like what, the importance of like where to start, where to put needles.
Yeah.
I have a question.
Yeah.
This is inflammation, it's red, swollen. What about scar?
Scar. So,
Same?
same. So a scar tissue is, the body has healed itself, but only to a certain point. So to the best of its ability. Sometimes it's a little patchy and it's imperfect. And because it's healed all the way, there's limited blood circulation in a scar. So the body doesn't realize that there's an injury site there. So you take small needles and you puncture into the scar, and now the body recognizes, oh, now there's a new injury. And so then it begins to bring blood and white blood cells and blood circulation and to clean that area.
So actually this guy, the Alan, I did this last time, this dragon around this hamstring.
Yeah.
The big ball. So it should be done every time.
Yes. And he needs combination of needlework, manual therapy. This is a manual therapy as well as exercise rehabilitation because he needs to stimulate it and regrow. He needs to regrow his hamstring. So you can do that sort of thing. And so when you're you're considering point selection, it's like be very clear and intentional about your needle selection. And you can't do everything in a treatment. So this is a very sports medicine type treatment, very muscular skeletal. Now, if you want to use more of the energetics of the medicine, of the point function, so now you determine that the body has heat. Heat is inflammation, heat is red. So now you can use the energetics points. So now you maybe needle LI11, maybe what's a heat clearing point? Maybe gallbladder 34, UB40 on the back of the knee. Yeah. So then you try to clear heat, and so then you release the muscles. You do a musculoskeletal style treatment, and then maybe the follow-up treatment, then you do a heat clearing treatment. And then you don't do this sort of thing. You let this settle, and then you give them exercises, and then the next treatment you're doing heat clearing points. And then the next treatment you're doing blood invigorating points where you're trying to invigorate blood through the system. Now you're doing 4 gates, gallbladder 34, and so you're doing it that way. So you have to be very what are you trying to accomplish with the treatments?
Is it good to mix up the treatments that often? Every other time?
I think it is, because in the sense you can't do the same workout every day.
But if the patient comes like once a week, it's almost like you're starting all over, no? Yes. And so imagine, you exercise and you go work out and you're sore for maybe 3 days, 4 days. And then
and then the effects of that training session has diminished. And so then that's when you would apply the next treatments, the next training session. And so in the same way, acupuncture, when you put a needle into the system, into the body, a small micro tear is created. It takes maybe 3 days to patch that little micro tear, run the course of the internal physiological changes of the treatment, and then that's when you would apply the next treatment. Right. And so really the ideal is
like 3 treatments.
Twice a week for 10 treatments, and then reassess. But along the way, you're looking at their tongue, you're looking at the subtle changes, and you're clearing heat. You're releasing any tension along the way. And you can add some of these accessory points along the way. And you can do, with that initial musculoskeletal type treatment, you can put heat clearing points into that treatment. But then you get a little pulled away from the specificity of that treatment. Are you trying to release the musculoskeletal tensions, or are you trying to clear heat? Or are you trying to invigorate blood? Clear dampness. You can't do everything at the same time.
So which one's more important?
I think it's important to try to get the patient to feel better immediately. So if you can release the tensions of the body and reduce pain, that's a good place to start. Then go after the inflammation, then go after the internal ingestion of supplements and these adrenals, upregulate the digestion and get their digestion going. Because without digestion, your body's not going to be clearing out inflammation. So, and if your body's hot and it's running hot, you're not going to be sleeping. So just things to consider. But zigzag, and imagine a yin yang symbol over the top of the body. And then so if we did one more, just to kind of reiterate, and also what I was saying earlier with where do you start? Don't forget that you're moving energy throughout the body. You're a body electrician with this. So stay with what you do, wherever you put the needle, stay there and work from there. So that's why I always like to do a dew point or a Ren point, because that's center line. So if you activate the spine, that opens up chi and blood circulation to all subsequent meridians, right? But then if you say you put a needle in LI4 here, just imagine this is LI4. You're sending input to the nervous system up to the brain, okay? And so now you've sent chi this way. So now stay with that chi circulation, and now maybe go to LI15. You stay on the same channel.
Tony, why are you going this way towards the spine? Because of the nervous system?
Yeah, I'm saying you're sending input. Okay. It is going two ways. It's going both ways. But I'm only saying you put stimulus here, and now you've sent electricity and chi out to this area. So now chi is being sent from the spine to here, right? And so now you've created this beacon and this momentum of chi here. So now maybe go down and put CV17. Now stabilize that. Now maybe continue to go down the spine, CV12, CV6, maybe go down to the leg, maybe go down to the foot, and then maybe come back up, maybe come up to the head, maybe yin tong.
So you're thinking this is our chronological order of needle placement?
Yeah, and so just have a clear, be intentional about it. It's not, I'm only saying this theoretically, and just generally speaking, be clear, because you wouldn't want to put LI4 here, and you've created this momentum from the brain, down the spine, into the meridian system, into the hand, and then you put some random point over here in the foot. You're interrupting this right here. So stay here. Maybe stay on this side of the body, maybe do stomach 36, then come to the foot, then come up to the hand, then up to the head. And you're trying to circulate, all you're trying to do is just circulate qi and blood throughout the system, okay? So it's like, are you trying to invigorate blood? Are you trying to clear heat? That's where we come back to this. Then you do a heat clearing protocol. Now we do a blood invigorating protocol. Then you do a sports medicine, muscular skeletal, shoulder, hip, legs, foot.
And can you repeat the heat clearing thing again?
Well, if I told you your treatment strategy was clear heat, what would be 3 points that you could, what are,
LI 11,
UB40.
UB40?
And UB15.
And, stomach 36 clears fire, stomach 40 clears heat, stomach 44, liver 2, right. So there's multiple points, and so I always like to compare acupuncture to when the body falls out of balance like this, it's like you're tuning an instrument. The body has fallen out of equilibrium. All you're trying to do is just tighten the strings, like a guitar. And that's all you're doing. Or loosening, because this is like tightness. So now you're trying to loosen the strings. So just something to consider. But either way, whenever I treat a person, imagine a yin and yang symbol drawn across. And you're trying to center it. So that's why you don't needle the body 50-50, because it's not, a yin and yang is a black fish and a white fish. It's not a black circle, it's a black and a white circle. So you have to kind of, the treatment should be offset just a little bit, and that creates the momentum.
So do you think like the energetics of the point happen if you just do it unilaterally too?
I do.
Yeah, I know.
Yeah. If you put in LI 11 to clear heat,
It
clears heat.
You don't need to do
I think it can enhance the function if you have like rheumatoid. I think if you put it on one side, it would be more heat clearing on one side, but because the nervous system is looped up, it's gonna send heat clearing across to the other side.
Okay.
So, but hard to say because that's. But I would say if you put in kidney 3, you're gonna get kidney tonic. But then you can argue, well, if you put a kidney point in on the right foot, it's going to send it up to the right kidney, but maybe not as much to the left kidney. But again, the nervous system's looped, so yeah. So I don't know.